Have you ever experienced bloating, fullness, belly pain, gas, diarrhea, headaches, fatigue, or brain fog? Have you ever experienced those symptoms and then thought about or been told to avoid a certain food or food group? So this is a great introduction in how easy it is to just blame food for all of your problems, and sometimes it really is the reason for problems. But for the most part, do we need to eliminate an entire food group? Probably not. So we're going to talk about that a little bit today. And it's really common for people to feel as if they have food allergies, intolerances, or sensitivities. And these terms are often used interchangeably. However, it's important to understand that allergies are very different than intolerances and sensitivities. And we're not really going to go too much into the allergy portion of it. We'll talk about some testing and things like that. But for the most part, we're going to focus on intolerances and sensitivities. So first, let's kind of break down the difference between allergies, intolerances, and sensitivities, and Alex is going to do that for us.
Yes, so like Sarah said, they are not synonymous. You can't use them interchangeably. People do all the time, though, which can be confusing. So an allergy is a real immune response to an allergen that results in reproducible symptoms with every exposure. This is something that can be dangerous. So if you're allergic to like peanuts or shellfish, if you eat something like that, you can go into anaphylactic shock. So that's just one example of what an allergy could be. So that's a serious reaction. It can be dangerous. It can be life-threatening. So if you have an allergy, you probably know that already. The next one is intolerance. So this is a non-immune response to a substance, so food, that causes GI symptoms with exposure. It comes and goes over time. It's different responses with different quantities. This isn't necessarily dangerous, although it can obviously be uncomfortable. So like lactose intolerance. If you do have lactose, you may feel really uncomfortable, that bloating and diarrhea every time you have it, so then you can associate that you're lactose intolerant to that. However, it's not going to be life-threatening. You probably aren't going to be carrying around an EpiPen for that. That's more so with allergies. And then our last one is sensitivity. So this is probably the one that's used most often, yet it's most broad. There's not really a single definition to what a sensitivity is. It is not an immune response. It's often applied to a variety of symptoms without evidence to support use. So saying, I'm bloated and I think it might be because I'm sensitive to XYZ food. That's really hard to narrow down. And people try to use it across the board for all types of foods. I'm sensitive to this, and this. So it can be really confusing, and we're kind of here to break it down for you.
Well, and on top of that too, I myself and you guys as viewers too have probably heard dietitians or physicians even use that word. And I know I personally may have used it and then corrected myself. Oh yeah, wait, no, we're not talking about sensitivities. My own doctor has used it to me, the word sensitivity. And just to kind of give you a sense of this, there's something called the International Classification of Diseases. So they're codes, and this is how we code for disease in the hospital setting. And so if there's a disease that we see in the hospital, we have to have a code for it for insurance reasons, documentation, and things like that. And right now there's over 70,000 different diagnoses that have an ICD-10 code, but there's not a code for food sensitivity, which is interesting. And so that's just another reason as to why, I believe that there really is no agreed upon definition and things like that. So Cassie's going to kind of dive us into food intolerances.
Yes, so there are very common concerns that people have regarding their diet and any symptoms they have. However, it's a normal part of the human condition. What we eat does impact how we feel. And just because beans make you gassy, for example, that doesn't mean that you have a food intolerance to beans. It just means that they're a little bit harder to digest and they can cause some extra gas. Mm-hmm. And that can be very normal. It's not an immune-mediated reaction to a food, more so difficulty with digestion. And so sometimes that can be so uncomfortable that you don't want to have it, or maybe you need to have less of it to feel comfortable. So knowing what foods can cause that can be helpful. And the most common food intolerance is what Alex mentioned earlier, lactose intolerance. And I know if I drink a glass of milk, for example, I feel horrible. So I don't want to drink a glass of milk, but that doesn't mean I avoid all dairy. And so that's something that is really important to realize. You can't say, well, I have a dairy sensitivity and I'm never going to eat dairy and I can't eat dairy. dairy. That may not be true. So it may be true, but it may not be true. And so it's really, something that you need to get a little help with sometime to see. So, and there are lots of products out there that can help. So you can actually take, if you're lactose intolerant, you can take the lactase enzyme, which is what you are deficient in probably, the reason you can't digest it. And also, like we mentioned earlier, it can sometimes come and go. So you might have certain times when you can't digest lactose and other times that you can. That can be normal too. But people with lactose intolerance, like I said, lack the enzyme lactase, which digests lactose. And the sugar passes through the small intestine undigested. And as it passes through, osmosis sucks water and air into your bowels, which gets uncomfortable and leads to bloating, diarrhea, constipation, maybe some stomach pain as well. Reactions can vary from time to time, like I said, and it can go away on its own. You may, like say you take a medication, sometimes antibiotics are notorious for this, and they can make you not able to digest dairy well, and then a few weeks later you can. So it's just something that, again, you have to look at your symptoms and treat those symptoms instead of just eliminating all of the dairy products possibly. And some dairy products have lactose and others don't. It's a common misconception too. I was just talking to a client yesterday about this, that lactose is the carb part of it. And a lot of the intolerances that we see, or people that have issues, is often with the carb portion. And so often allergies tend to be more with the protein portion of the food. And so cheese, for example, a lot of cheeses, hard cheese especially, has really no carb in it. So those don't have lactose typically, and people can sometimes digest those. Sometimes they can't. And so it's just, again, everybody's different. And I wish it was easy in black and white, but it's not. So, we look at, like I mentioned with the carbs, we also look at FODMAPs. And so this is something that is scientifically researched. And those are, you're like, what are FODMAPs? And those are simple sugars found in fruits and veggies, which some people may have difficulty digesting. So some people that have IBS or other symptoms can't tolerate a lot of those. And so we actually will do elimination diets and test those. And again, that's based on symptoms. And we see, okay, which of these groups do you have symptoms with? How much of those can you eat before having symptoms? And we try to help people with figuring out a food plan that is realistic and also has as much variety as possible for them to eat and still feel good. And you can do that, but it does take some time and looking into it. So as far as intolerances go, symptoms are real, those are real, but it's really a food-based approach and a symptom-based approach that you look at.
Yes, so it's not easy to figure out. So that was intolerances, and Alex is going to dive into food sensitivities and start to dig into some testing for all of those things.
Yeah, so we broke it down: allergies, intolerances, sensitivities. So now we're back to sensitivities. And to reiterate that word, there is no agreed upon medical definition as to what a food sensitivity is. It is not an immune response. Again, not agreed upon, so just kind of keep that in the back of your head. This term has been used in numerous ways to support unvalidated testing, marketing, products, and services. So if you feel like you have X sensitivity, try this product. And a lot of times they're in different pharmacies and not recommended by a lot of people, and then people just buy them and companies make money off of it based off of your symptom, which you could come see a professional and kind of break down what maybe is going on. Incorrect testing for food allergies, intolerances, and sensitivities. There's a lot of this out there. So many people who experience the symptoms we listed earlier, so like that bloating, brain fog, diarrhea, those types of things, become hopeful to find a single test that will tell them exactly which foods to avoid so that they can begin to feel better. However, no single test exists that can give you this answer. We're sorry about that. If there was something like that, then maybe we would be recommending it, but there's nothing out there right now backed by research that we would say, okay, we should all be trying this to see what we're sensitive to. And again, that sensitivity, it's a very large term. There's not one definition. So it's hard to define a sensitivity, which is kind of what we're trying to say here. You'll see these tests on the shelves in pharmacies being recommended by licensed and credentialed healthcare professionals. And it seems very confusing. Why would they be sold at pharmacies or be recommended by my doctor if it wasn't a real test? And that is kind of a scary thought, just to have it in a pharmacy and be like, yeah, you need to go try that because you might be sensitive to this. And it might be just putting a Band-Aid over the underlying cause of what's going on.
And people should really learn to be skeptical about those kind of recommendations. If it sounds too good to be true, it might be. Just like, the same thing we talk about with supplements and pills and all of those things. If it sounds too good to be true, it probably is. I'm just going to share a quick story of when I was at my doctor, who's just a general family practice doctor, very smart, very educated, however, not a specialist in, gastrointestinal problems, allergies, and things like that. And so I've recently this year been trying to figure out my underlying stomach issues, which has involved lots of testing, lots of money, and we kind of just ruled out all of the big things, parasitic infections, colon problems, things like that. I'm 24 and I've had a colonoscopy, yay. And after there was no big blaring problems, I got recommended to do a food sensitivity test. And the word food sensitivity test wasn't used, it was the name of it, and it was just to help, I think she described it as just to help kind of figure out what foods trigger problems. And so I asked her, what type of test in this, and I'll go into details about immunoglobulin G versus E and things like that, but I asked her if it was an IgG test, and she said, well, I don't know. Does that make a difference? And so me, as someone who does know the difference, I was able to be skeptical and ask those questions. And we don't expect you to know all of those things too, and you don't have to necessarily sit here and interview your physician. They know a lot of good things, but like I said, if something sounds too good to be true, it might be. So my knowledge and my education was able to help me in that case and having to avoid 50 to 100 foods possibly, and pay like $400 for that test because insurance doesn't cover it. And some companies really are out just to make money off of you. I don't think that was the case here, but it's definitely a problem. So let's kind of break down what that test that was recommended to me involved. So one test that claims to be able to diagnose these food sensitivities is with the IgG test. And it reports IgG levels to multiple foods. It can be anywhere from like 90 to 100 foods with like one spit or one hair or something crazy, or a drop of blood. And so IgG it's called immunoglobulin G, and this is the most common antibody found in the blood and in other body fluids. You have other immunoglobulins in your body too, but we're just going to talk about G and E today. And so another name for this that it's been commonly called is the memory antibody. And people with higher levels would be expected of any person who consumes specific foods more regularly. So like I eat chicken, so I would probably have higher IgG levels with chicken, just a broad example. And so let's talk about how an IgG level may potentially reveal a food sensitivity. Well, in short, it doesn't. The presence of IgG indicates previous exposure, not hypersensitivity. So basically, it's telling you that you ate this. And in fact, it may really be revealing a tolerance to these foods. So I've had clients who have brought in their IgG test to me, and I've asked them, what foods do you avoid? And commonly things like dairy or gluten will be avoided. And so on those tests, it's interesting that anything that contained gluten, wheat, barley, and rye was not on that test because they avoided that. And so they obviously don't have IgG antibodies to that. So again, another reason why, hey, this might not really be exactly what these companies are marketing them to do. And so anyways, there's additionally, think about when you go get your labs tested at the doctor and, they say your cholesterol's high or your triglycerides are high. Well, they're saying that because there's a normal range established. Well, there's no normal range established for your IgG antibodies at all. So I'm curious to know how they're giving they're placing those foods on your sensitivity panel because there's no normal range. What is high? What is low? Well, we don't really know. And so additionally, when you get your results back, these companies and some Other healthcare professionals claim that removing these foods with the high IgG levels can lead to improvement in symptoms. And most of the time we hear that when clients remove those foods, they feel better. And what we call this most of the time is the placebo effect. If you truly believe that you are going to feel better when you remove these foods, and maybe you even start eating an overall more healthful diet, when doing that, you might feel a little bit better. And just as any chronic condition or chronic disease, there's going to be periods where your symptoms are worse and your symptoms are better. So maybe you just happen to remove those foods during a time period where your symptoms are better. Who knows? There's a lot of different things that can go on. And so if you've seen information that supports these tests, just know that it's out of date. That's probably in a non-reputable journal or by someone who is non-reputable, and they may not have even used the IgG test in question. So that was a lot of information, but that was just to educate you on what exactly is being tested and why that doesn't necessarily make sense. So Alex, I'll turn it over to you.
Yeah, and just to kind of go into that just a little bit, like we've gotten clients that come in with their results, and there's probably 50 at least foods, and it's so random. Like the ones I've seen, it's like cashews to egg yolks, not egg whites, mangoes, like that are high. And it's just, and it's from that IgG response, and it's something that we have to really think about as a consumer. What am I really testing? And take the results with a grain of salt, and maybe just don't even do it. Because then you can see a dietitian and we can break it down for you without the sensitivity stuff. If you have ever gotten and seen all those results, then you probably just throw your results away. You wasted your money. So there's something called the Choosing Wisely series, which was developed by the American Board of Internal Medicine 20 years ago and is present in 20 different countries. So it's very reputable. From an allergy standpoint, this is their position. The number one thing that the healthcare professionals should not be doing is performing these types of tests that Sarah was just talking about. In quotes, don't perform unproved diagnostic tests such as immunoglobulin G testing or an indiscriminate battery of immunoglobulin E tests in the evaluation of an allergy.
Word for word.
Boom, mic drop, don't do it. And then the American Academy of Allergy, Asthma, and Immunology, European Academy of Allergy and Clinical Immunology, and the Canadian Society of Allergy and Clinical Immunology recommended against using IgG food allergen testing. Whew, that's a lot of people not recommending it. In their position statement, they state the improper use of certain tests to make diagnoses in the absence of supporting clinical evidence can lead to poor patient care, can have a serious adverse impact on patient quality of life. So again, these are just other reasons from professionals that have studied this for a long time as to why we shouldn't be doing these types of testing.
Yes, and Cassie, what are some additional cons?
Yes, some additional cons. There are some more.
Wait, really? More?
And this is what, we see a lot. Results can be misinterpreted, especially in absence of a thorough history and diet recall, and they can lead to diets that may be nutritionally inadequate, not covered by insurance, and they can lead or trigger to an eating disorder or disordered eating. It also can delay the diagnosis of other medical conditions. So say you go in and you get this test done and they tell you that you shouldn't eat any wheat or gluten, and so you take that out and you actually do have celiac disease, so you actually do have an allergy to gluten. Well, you're not going to be able to test for that if you've taken gluten out. And so, and then if you don't know that you have a true allergy, again, it's more dangerous if you eat that food. And so people who have celiac need to really avoid wheat and gluten. And so people that have an intolerance don't necessarily need to totally avoid it. So you need to know those things, and sometimes this can interfere with the diagnosis of an actual medical condition. And we see this, I see this all the time with clients that maybe have disordered eating or very restrictive eating, and then they want answers, which we totally get that people want answers. Mm-hmm. We understand why people are drawn to this, and it sounds really good. And again, GI issues are so difficult because they do vary by person. There are no black and white answers, and a black and white answer is always going to be exciting for people. Unfortunately, that answer that people are getting isn't necessarily an actual answer. So it's just making people feel like it is. And I have seen this, and it definitely can contribute to either making people cross that line over to disordered or overly restrictive eating, or go back to that if they have been there before. So if you want to give someone an eating disorder, give them a long list of foods that they need to avoid because of some unvalidated tests. So it's something that we get a little fired up about over here at AYB.
Absolutely.
Because we see the negative effects. And a lot of people that are out there doing these tests may have no idea about the impact that they're having on people's lives. And we see that, though, and we see the stress that it causes and the fear really that it causes in people. And if they already are predisposed to having an eating disorder, it just can make that so much worse. There's something that's called orthorexia, which is an eating disorder characterized by having an unsafe obsession with healthy food. And we see this type of thing as well. People are so anxious about the ingredients in their diet that that's all they think about. It really takes up so much mental space in their day. They can't just eat a meal without being anxious or overly stressed about it, or maybe they can't eat out anywhere because of these supposed food sensitivities that they have. They may not participate in events or parties or go to someone's house to eat or any of those social things that are healthy to do because they're scared to eat other things. They may always be thinking about, what am I going to eat? Where am I going to eat? What can I do? They may not be able to go on vacation or go to a restaurant and enjoy all the positive things that food can bring and the joy that it can bring. And again, these are lasting things that people can experience from this test that isn't even real.
Well, and think about how much stress that creates too. And stress, it has a physiological response. And so then your body reacts to that stress, and then maybe you're really just reacting to that stress, but then, oh wait, I ate this from this restaurant and we don't really, it just it's a domino effect. And one, we hate to see someone that is so miserable and is just so overwhelmed with everything around food that they get this type of response to it. And so actually seeing a person and getting advice from someone who you trust, because we're skeptics, right, is one of the best things that you can do. So we'll transition into actual diagnostic testing, mainly for allergies. However, just like Cassie said, it's not black and white, it's not. And so we don't diagnose allergies as dietitians. That's something that you would need to go to a physician or an allergist for. And so all of this information I got from a pediatric allergist who has some awesome continuing education online for us as dietitians to use. And it was really interesting to hear him talk about it because, you hear the word diagnostic test. From that test, you get a diagnosis. Well, he really stressed the fact that it's still not that simple. You have to meet the client where they're at, figure out what triggers a response, what's the benefit of taking this food out, what's the risk of avoiding it, and things like that. So fortunately, it's still not black and white. However, there's pretty much two things that we really have to take into consideration, and that's kind of like what we do, which is getting a detailed history, understanding what the client's eating, how much they're eating, when they're eating it. So we call that a detailed history. And additionally with that, you ask them, what foods are you worried about? What symptoms are you worried about? What's the timing of onset? Are you eating something and then, 4 days later you're having a response? Well, we believe you that you're having a response, but does that necessarily mean that you have an allergy? Maybe not. With an allergy, Alex said this when she first read off the definition of it, but all symptoms should be reproducible every time. Are they going to be to the extent that they were, a month ago? Maybe not, but you should have a reaction every single time. Is it quantity related? Kind of like what Cassie said with lactose intolerance. Certain foods may not trigger as big of a response. And then we also use this in conjunction with what's called skin prick testing or serum-specific IgE testing. So immunoglobulin E, which is different than G. And so Alex is going to kind of take us into what those tests entail.
Yeah, so we're going to start with skin prick testing. And again, this is diagnostic testing. So you take a drop of liquid allergen, put it on the back of your forearm, gently scratch the skin, and introduce the allergen to the mast cells or allergy cells in the skin. If the IgE antibody is present, it will open up a mast cell and release histamine, which causes a hive. So you'll see that response on your skin. The size of the hive that appears within 15 minutes tells us the likelihood of food allergen being present. This is only helpful for IgE-mediated food allergies in conjunction, which Sarah talked about, with a detailed history. So we need that whole history, or your physician needs that whole history before they were to do that. And it doesn't tell you the severity, so that's something to take into consideration as well. And then moving into serum-specific IgE testing, which is a blood test. You draw blood and it measures your IgE levels toward one or multiple different foods. It's criticized because it's confusing results. There's lots of things to take into consideration, so it can be kind of confusing. And it also doesn't tell you the severity of that allergy. So can you eat a little bit? Are you going to get an allergic response? If you eat a lot of it, are you going to get an allergic response? So it's hard to tell the severity. The Choosing Wisely series also states that IgE testing should not be performed without a history consistent with the potential IgE-mediated food allergy. Hence, the testing we just mentioned is not valid unless a detailed history is also used for the diagnosis.
And if you are concerned that you may have a food allergy or you think you would benefit from this testing, that's something that you would need to, reach out to your physician for. And if you are interested in investigating different foods that make you feel bloated or make you feel uncomfortable or things like that, that's something that we as dietitians can help you with. So let's answer the question, are food sensitivity tests legit? In short, the answer is no. And as much as, honestly, we wish they were, because how great would that be? Make our life a lot easier, too.
Yeah.
So instead of wasting your money and buying into more of the quack that this society unfortunately has put out for us and for you guys as consumers, we recommend you bring your symptoms up to your doctor while working with the dietitian. Because in this setting, you can go through your food history, you can work to subtract and then slowly add or reintroduce those foods to determine the root of what foods are actually causing problems and if foods are actually causing problems. So remember, real ways to identify actual food allergies are not through I think one brand I can think of is like the Everly Well test. They have actual TB commercials. Those are not validated, especially for food allergies. So you would need to bring it up to a specialist, go through skin prick or skin scratch tests and blood tests, which measure IgE levels, not IgG, that's present in those food sensitivity tests in conjunction with the diet history. Or you can do what's called an oral food challenge under supervision of a physician. So if you have questions on any of that, please schedule a free 30-minute consult with us. We would love to help you all investigate that, because no one likes to feel bloated, no one likes to be gassy, but sometimes it really just is a normal response to food, and that's something that we can help you all figure out. So thank you for tuning in. We love talking about this. we always want to hear your guys' recommendations too, so send us a message if there's anything like a food sensitivity test, something that you have been recommended that we can dig into for you, and we'd love to talk about it. So we will see you guys next week. Thank you.
Thanks.